It's time for your weekly capsule of health information. We like to call it Your Healthy Dose, brought to you by Hannibal Regional Hospital and Hannibal Regional Medical Group. We talk about the month of October being Breast Cancer Awareness Month, and we're going to talk about mammograms this morning with Dr. Patricia Herner. Doctor, good to see you this morning.
Good morning. Thanks for having me.
So let's talk about mammograms. Basically, this is an X-ray of the breast.
Correct.
Okay, so when do doctors recommend that a woman get a mammogram?
Well, we usually say between the age of 35 and 40, you should get your basic one, your first one, so you have something to compare to. Then at age 40, we recommend once a year, we and the American Cancer Society.
Okay, so the first one, the initial one, is what they call the baselines, and that's the comparison one.
Correct.
Well, what is it that the doctor looks for?
Well, on mammograms, we're looking for changes. That's the reason we get a baseline to see what does it look like in the beginning. And then we're looking for, are there what we call calcifications? So they look like little white dots on the mammogram. Mm-hmm. We're looking for things that could be the earliest sign of cancer. Also, we call them asymmetric densities. So if there's a white spot, it should look more gray as we get older in our breast on our mammograms. And if we start seeing new white spots, then we're wanting to know what is that white spot.
Okay, so the cancer does it look white or does it look gray? You said it's supposed to look gray.
Gray, as most women when we're young, because of the way mammograms are done, they'll look dense or white. As we get older, the breast becomes more fatty, and then it becomes more gray on mammograms. Okay. So something that's new or denser is whiter.
Okay. All right.
So when should somebody have a baseline? Because you want that to go by.
Right.
When they come back again, you want to have a baseline to work from, but when do they do that? What age?
We usually between age 35 and 40. Most women's gynecologists will recommend they get one somewhere in that age group.
Okay, now you say women. What about for men, too? I mean, I know that we're talking both genders at this point.
Right. Breast cancer is primarily a women's disease, and so men can get breast cancer, although it's rare. So we don't generally do screening on men, but actually men can get mammograms.
They can?
Yes, they can.
But it's something that, do you suggest that they do, or really depends on the individual, their weight and all that?
It depends on if they have a symptom. So if they have a mass, then we do a mammogram on them. So even a fairly flat-chested man can get a mammogram.
Okay. For a woman, who's the most at risk for breast cancer?
So breast cancer risk, the highest risk is having a family member. So a first-degree relative, a mother, a sister. You can go out to grandmother at an early age. So those are the people who are at highest risk. Now, having said that, the most common, or the people who get breast cancer the most, are not necessarily people who have relatives. So that's the reason we really push the mammograms. And at a young age, we're asking them to do their self-exams. Even teenagers need to start doing self-exams.
Mm-hmm. And how do they learn to do that?
Well, hopefully their physicians will teach them. Their mother should teach them. Basically, what you want to do on a breast exam on your own is usually in the shower. You do it, and you feel each area of the breast. You look at your breast in the mirror, and that's usually what you start with.
But then from that point, you look for any changes?
You're looking for changes. Women tend to not like to do breast exams because they say, oh, my breast is lumpy. I don't know the difference. What I encourage women at early ages to start doing their breast exams once a month, usually when the breast is at least tender, so it's after their periods. And they should start doing them so that they get used to what their lumps and bumps are. And if something new comes up, they really will find it.
Is there pain in doing that self-exam, and is there pain in doing a mammography?
Self-exams are not painful because you're doing it yourself, but you should also have your physician do it once a year, particularly as you get older. Mammograms are uncomfortable, but...
not really pain, but just...
Yeah, it's uncomfortable. It's getting squeezed.
Well, I've always said that the machine was designed by man in the first place.
Most women will say the same thing.
Exactly. Yes. So, but again, you need to get it done, and you need over 40. You need to get it done. Once you get the baseline done, do it once a year.
Correct.
Okay. So, what are some of the signs of breast cancer outside the mammography?
Well, again, so since we're doing self-exams, we're going to find lumps and bumps that are new. So you're looking for on your self-exam, is there a new mass? Is there something new texture-wise? When you're looking in the mirror, you're looking to see, is there a change in the skin? Does the skin, instead of looking nice and smooth, does it start to look like an orange peel? Is there redness that hasn't been there before? Those are some of the things to look for.
Doctor, what about technology? Some great advances in technology, right?
There are some great technology. Now, our mammograms are even much better than when I started. We now have digital mammograms, so they're very good. Ultrasounds. So if we see something on mammogram or if a person feels something, often we do ultrasounds. And sometimes you need to do both. It's not just one or the other. MRIs are now very, very good, very sensitive. Now, not everybody needs one, but it is a good screening on some people.
And it really breaks down in very good detail.
Oh, absolutely.
And really the physician has an opportunity to look at that in almost three-dimensional ways.
Yes, and there are coming out some three-dimensional mammograms, but those are still a little bit in the future for our area.
Okay.
What about treatment for breast cancer?
Well, the first thing, if we catch it really early, sometimes the surgery ends up being the main treatment. It won't be the only treatment, but it's the main treatment. Once we've done surgery, then if we do a lumpectomy, they may need radiation. And then chemotherapy, if it's caught very early and is not a very aggressive tumor, it may just be a pill for 5 to 10 years. If it seems to be a little bit bigger tumor involved in lymph nodes, it may be chemotherapy, which we consider IV medicines.
You made great progress in treatment, right? Isn't the success rate on the rise?
Yes, and the great thing about some of the treatments is now once we diagnose this, sometimes we treat it with chemotherapy up front before we go to surgery, and we can go to surgery and there'll be just a very small tumor, if anything, left in surgery. Mm-hmm.
It's amazing how fine the treatment has become, and even biopsy, without having to really do a lot of damage or an intrusion.
Most of our biopsies now, we do what we call needle biopsies. So we do them in the office under ultrasound. It takes about 10 minutes, and no general anesthetic. We do obviously numb it up so it doesn't hurt, as opposed to years ago when we went to surgery every time and it was a big ordeal, and so it's much nicer for the ladies.
Well, and a little bit of bragging, because the Hannibal Clinic designated Breast Imaging Center of Excellence, American College Board of Radiology, ACR, has given a thumbs up.
Yes, we're very proud of that.
So,
we work very hard at it. It means that the radiologists, the surgeons, and everybody involved have met the qualifications.
And peer review evaluations continue the process, giving thumbs up.
Yes.
So that's very important. All right.
We're very proud of that.
For more information, Dr. Herner, if women have any questions about self-exam, about seeking more information about getting that baseline done, can they get more information online?
Absolutely.
Okay.
Online on the Hannibal Clinic website, on the Hannibal Regional Hospital website.
Okay.
And of course, you can always go to the American Cancer Society.
Okay. Yep. That's a very good point.
Probably a good idea to start with your primary physician too, right?
That is absolutely the best place. Women, most people have a gynecologist. Women have a gynecologist. That's a great place to start.
Mm-hmm.
Have that dialogue.
Yes.
Yep. It's probably the most difficult thing to do, but you got to get it done.
Got to start.
Yeah, got to start. Guys, nag her along.
And if men find something,
yep,
you need to have it checked out too.
Need to get it checked out.
Don't just assume you can't have it.
Exactly. Very good point. Dr. Herner, thank you very much. Great information there.
Thank you.
Thank you.
Dr. Patricia Herner, our guest, as we talk about October and Breast Cancer Awareness Month. If you'd like more information, again, you can go online, hrhonline.org.